Atrial fibrillation, or AF, is a heart condition that causes an irregular and often abnormally fast heart rate. A normal heartbeat is around 60 to 100 beats per minute when someone is resting, but some with atrial fibrillation, this may increase to over 140 beats per minute and may be irregular. There are different medical devices you can use at home to check if you have AF, and these include smartwatches and testers. The condition affects the person by fast irregular heartbeats, out of breath, dizziness, tiredness, but in some cases the person may have no signs or symptoms. You may be aware of noticeable heart palpitations, where your heart feels like it's pounding, fluttering, or beating irregularly, often for a few seconds or in some cases a few minutes. In someone with this condition, the upper chambers of the heart, called the atria, contract randomly and so fast that it doesn't allow complete filling of the chamber in between contractions. Therefore, they reduce the efficiency of the heart. There are around about 500,000 people in the UK with this condition, and it's the most common heart rhythm disturbance. It can affect adults of any age, but affects more as you get older and more men than women. Around 10% of over 75s have the condition, and the risk of this is increased by people who excessively smoke or drink. It is also more likely to affect people with high blood pressure, heart valve problems, or other medical conditions. There are different types of atrial fibrillation, and these have different effects on the patient. One of the types affects the person and will usually stop within 48 hours without any treatment. There's also a persistent atrial fibrillation. This lasts for longer than 7 days or less when it's treated. Long-standing persistent atrial fibrillation, this lasts for longer than a year. And permanent atrial fibrillation, this is present all the time, and there are no more attempts to restore the heart to a normal rhythm. Although uncomfortable at times, some with atrial fibrillation can lead a normal life, and the condition can be controlled with medication, but it does increase their risk of stroke. Treatments can vary depending on the person. That includes medications to control atrial fibrillations, medications to reduce the risk of stroke, or even maybe having a pacemaker fitted. The NHS say to see a GP or call 111 if you have chest pains that comes and goes, you have chest pain that goes away quickly but you're still worried, you notice a sudden change in your heartbeat, and your heart rate is consistently lower than 60 or above 100, particularly if you're experiencing other symptoms of atrial fibrillation such as dizziness and shortness of breath. It's important to get medical advice to make sure there's nothing serious. Call 999 if you have sudden chest pain that spreads to your arms, back, neck or jaw, makes your chest feel tight or heavy, you have shortness of breath, you're sweating and feeling or being sick that lasts more than 15 minutes. You could be having a heart attack. Call 999 immediately as you need immediate treatment in the hospital.